Good morning, everyone. Today, our group will be presenting on how healthcare professionals can better adapt their communication and provide better education to patients when interacting with them. My group today is comprised of Morgan, Indira, and myself. Morgan is a business consultant that's been in the healthcare industry for several years now. Indira is a healthcare professional that's been in the industry for 20 years. And myself, I've owned several healthcare transportation companies in the past. And my name is Isaacson. And by the way, we gather our information by combing through McCory and Mason chapters 6 and 7 over the last several weeks to get this presentation ready for you.
Throughout this presentation, we want you all to remember that 36% of adults in America have low health literacy.
Thank you, Morgan. My name is Indira again, and our topic today will be, we will be speaking on Morgan, Eric, and myself, health literacy, language barriers, visual impediments, deafness and hearing loss, advanced age, delirium and dementia, patient assessment, and patient education.
All right. Morning, everyone. So for this, we want to teach you all how to be effective communicators in the healthcare industry. So I'm going to go over with you the health literacy, language barriers, and blind and visual impairments. So for Healthy People 2020, they define health literacy as, to summarize, the ability to be able to obtain, process, and understand healthcare information to be able to make your own assessment, to make your own health decisions. So we mentioned the 36%, but 12% of us are, it's only 12% of us that are actually proficient in health literacy. This is the ability to be able to navigate our healthcare system, to be able to understand our lifestyle choices, our physician instructions and healthcare information documentation that we give out, and numeracy skills to be able to understand our own dosages. So we're going to want to adapt our communication for everyone in this case. And to do that, we're going to do it through both instructions and our documentation that we give out. So as we speak to people, the best we can do is just ask and understand if they're understanding us. But to make sure that we're being completely inclusive, we want to limit our messages and use plain, simple language that people understand and tailor the treatment to what is their normal routine. As we give out documentations, it's best if we use images as much as possible and even use bullet points and headers to break down that information even further. All of it will be written at a 5th grade reading level, and if people are completely illiterate when it may come to it, we can serve as a reader. So language barriers refers to people almost exclusively as two people who don't speak the same language. So a lot of times when a patient doesn't speak the same language as the healthcare provider, they're less likely to speak up in general. Or in another scenario, they're going to use their friend or their family who does speak the same language for communication purposes, and we don't advise that. The issue with this is it could be speaking about sensitive topics and things of that nature, and it becomes an issue later on. So through all of this, we ask that you use a professional healthcare translator, someone who knows the terminology. We'll actually avoid any kind of slang or metaphors because those things can get lost in translation. So as we adjust our speech, we're going to speak directly to the patient and not to the translator, and we're going to use shorter sentences and try to observe their nonverbal communication, be sure that they're understanding. And then the last thing was the teach-back method, and that's when we ask them, the patient, to teach back to us and to make sure that they're understanding. Last thing I'm going to go through with you all is visual impairment. Over 25 million people in America have some sort of visual loss, and that was from the Health and Human Services. So to be able to adapt to them, a lot of these refer mostly to the very visually impaired. So we're going to walk in and we're going to speak clearly and say who we are. We want to let them know this is my name, I am a doctor or a nurse or whatever, so they know who they're speaking to. We'll address them specifically so that they know we're speaking to them and not necessarily a person they brought with them. And oftentimes they may have even brought together a service animal. And that service animal might actually, we can't distract that animal because it could have a very important job. As you're speaking, we don't want to avoid words like look and see. It's going to be awkward. It's going to be difficult for us to do to begin with, and it's going to be awkward for the patient if it's noticeable that we're doing it. So we tell them when we're leaving and coming in, so that they don't embarrass themselves as they keep trying to talk with us after we've already left. And then finally, when we give them healthcare documentation, we'll provide it in a format that works for them: Braille, video, audio, or large print, if it works. Now I want to pass this off to Indira, who will cover the other three groups.
Good morning again. All healthcare professionals can create a better understanding and effective communication when dealing with patients who are deaf, hard of hearing, advanced age, delirium, and dementia. First of all, we must identify what is deaf and hard of hearing by a hearing test. Deaf is severe hearing loss, which impacts the patient not understanding how to process and evaluate information. Hard of hearing is mild to moderate severe hearing loss. Mild to moderate hearing loss that the patient can understand some information, but yet they cannot. It affects the Institute of Deafness and Other Communication. Reports that 28 million Americans over the age of 65 has some sort of memory loss. In order to communicate effectively with these patients, there are some strategies we must use. We must provide a dignity with these patients by being patient, respectful, and considerate. We can also use nonverbal communication, direct contact with these patients, and making sure that you give them your undivided attention. You must have clear movements, clear mouth movements, patient read lips, and using an interpreter or visual aids like diagrams, pictures, or even movies, and also sign language will help these patients in communicating effectively. Now, the next one is advanced age. The aging population is increasing, and so too patients have been losing their independence. And most of the patients have increased doctor's visits, so we must take into consideration that by the year 2030, the U.S. Bureau has reported that 58 million Americans will be over 65 or older. And also some communication strategies we must use. We must provide these patients to ask questions, schedule earlier slots, and allow enough time for them to talk to the healthcare professional by giving them more information and important information about their healthcare and their treatment. minimize distraction, give them their undivided attention, and also involve family members who can help them because they have lost so much of their independence. They're not 40 years old anymore. They're over 65. So they need help from family members. Next is dementia and delirium. Patients feel that they're so confused. Who are dementia or delirium? As memory loss tests can identify whether delirium or dementia is acute or chronic. Delirium is acute, and it can have memory loss that will overset in a few days. Dementia is chronic, and it continues over a period of time, and eventually leads to Alzheimer's disease. The Alzheimer's Association has indicated that 10% of patients over 65 years and older has some sort of memory loss. 50% of patients 85 and older have some kind of memory loss. In dealing with these patients, it's very challenging. They're so confused, and they're more confused in the morning than the afternoon. In the afternoon, they call it sundowning because the sun is going down, I think. And they get more confused then. You have to call this patient by name and approach them from the front only. Speak slowly in a low-pitched voice. Ask one question at a time and give them one-step direction at a time. Avoid arguments with these patients and disagreements. And be mindful of their nonverbal behavior. Involve family members to help preserve their dignity and respect. In dealing with these patients, in dealing with all these patients and these segments, we must communicate effectively and use the best form of communication. And I want to say thank you very much, and I hope you all have learned something from this that will be beneficial to you. My mom was 87 years old. She had all three of these. God bless her soul. I want to now turn you over to Eric. He will be talking about patient assessment and patient education.
Thank you, Indira. Successful healthcare professionals know how to educate patients for a lasting impact. Today, I'll be discussing two topics: proper patient assessment and educational strategy development we can utilize when interacting with patients. Now, proper patient assessment, that is broken into situational and instructional context, patient demographics, as well as preferred patient learning strategies. Now, situational context, this refers to what's the medical condition that brought these patients into us today? Is this an acute illness or a chronic disease? We also need to determine what is the instructional context as well too, and that determines what is the environment that we're interacting in and how is that impacting us as well too. Are we in a hospital setting or an outpatient clinic? Is the room temperature hot or cold? And also, does the patient feel that they have privacy? After determining the context, we now need to look at the patient demographics and how that can affect the interaction and how we can properly assess them. They can be broken down into several different groups. Now, ethnicity and cultural background is one of them. And an example of ethnicity is that African Americans tend to be more mistrusting of the healthcare community because of experiments such as this Tuskegee project that happened in Tuskegee, Alabama, when syphilis was studied from 1930 for another 4 decades. They told a lot of these members that they were going to be treating them, but instead they studied them and watched them slowly, die and pass away. Next, we need to determine what is the socioeconomic background of the patient. What is the age of the patient? Typically older patients are going to be more respectful of us and listen to our input. We also need to determine, are we communicating in the patient's first language as well too, and what issues that can arise. Then we need to determine what's the patient education level. We learned earlier that a lot of our patients typically work on a 5th grade reading level, and we need to interact with them based on that level. We also need to determine what is the healthcare background of the patient. What have their prior experiences been in the past? And finally, we need to determine what is the physical and psychological conditions affecting them. And whether they're in pain or dealing with fear of a phobia of medical professionals. Now, we need to next determine what are the learning styles. That's broken into 3 different groups. They can either be visual, do they need pictures, literature, or diagrams? Are they auditory? Do they need discussion followed by questions and answers? And next, do they need kinesthetic, which is practice and demonstration? And after we determine how to properly assess a patient, we need to figure out what the objectives of patient education are. And they are changing the patient's health behaviors, which will lead to improving the patient's health outcomes. And then eventually improving the patient's health compliance, which this will help us be able to have them go in that positive direction and continue these great behaviors we want to impart. One thing we need to take into consideration as healthcare professionals is that patients that are fully informed of their current circumstances feel more empowered and informed to be able to make those positive health changes that they need. Now that we've covered what patient education objectives are, we now have several strategies and techniques we can utilize when we're interacting with these patients. We want to do a warm welcome and introduction. We want them to know that we're excited to be there rather than just looking at the computer the entire time. Next, we want to implement the ask, tell, ask technique. That's where we ask them, what do you think's wrong with you and why are you here? Then we tell them the truth of what's actually going on. Then we finally ask them, do you have any questions? Because there might have been some confusion that might have been created. Next, we want to implement plain language as we're going through this. A lot of our patients, unfortunately, don't know the medical terminology that we know, such as fibula and tibula. They know arm and leg, and that's how we want to break it down for them. Then we want to be able to fully inform them of what's going to happen from the care, of course, that we're prescribing. How long is this medication going to take to impact them? And also, what can they reasonably expect? We want to also encourage the patient to make smaller changes over time, because that way they won't feel so overwhelmed. And then we want to ask them to add new behaviors that are positive and link those behaviors to existing behaviors so that way it helps with the compliance. After that, we want to be able to use our white coat. And white coat is not just the coat that we wear, but also it's the fact that our patients see us as professionals in the healthcare professional industry, and that we can actually give them the straight facts and be honest with them a little bit. If they need to lose weight, we can tell them, you really need to lose that weight, and we want to do this for you. Next, we need to determine we need to make sure that we repeat important information. We need to get the important facts across so that way they don't get confused and walk away with useless information. And then finally, we need to respect the patient's decisions because it is their life after all, and we want to be able to get their respect at the end of the day. Thank you so much for your time today. I really appreciate it. I hope my presentation really helped assist you in being able to properly assess patients in the future, as well as to better educate them, so that way we can provide a better lifestyle for them and health status. We now have an exciting activity that Indira and Morgan will be passing out, where we're going to be going over over activities and situations that you guys are going to be able to interact with each other. We're going to pair off people two to a group, and then after you finish it, we're going to have a couple people volunteer to discuss what their experience was. Thank you so much today.
All right. Who's our two?
Who wants to pair up? Who wants to pair up?
Come on.
You guys want to pair up on this?
Two.
And then they're together, they're together, they're together.
Okay. Thank you.
And then you all together. Oh, sorry about that, y'all. Perfect.
So are you putting on the Word So you're copying things in the article into the... No. You're just... Spanish patient, we would get this one because there was been some symptoms of pretend you're trying to speak one. Oh, I see now. One is the patient, one is not.
You got it. You got it.
Just hit me.
anything like that. Don't worry. Okay.
So basically, it's saying that this one is to like 250 or 2 and 1 half. So it's not. They want to 2 pills.
Oh, nice.
And 2 and then 3 pills.
Oh, because they were taking one. We got a 1 bill. So we're taking this 2. The second one is
Or 2 and 1 half. So that would be taken twice a day. So I'm assuming they have
It's only
2
been like 3
pills.
minutes, that's it.
They had 2 pills at 100 each. So then now they have to take 3. So they take 2 pills. Just take half of one and add another half to the 2 that you have. No?
so then they're going to continue taking
Yeah.
2 and then
Just add another
half.
half of a pill.
So this is like from the
That's
patient.
what just makes it a little bit.
So what struggles did you go through? Yeah.
So let's just say 2 pills. We take a third one and cut it.
So now drop it.
So did you feel understood by the patient, by the physician?
Yeah.
We can say yes if it's a translator.
Because they're whatever.
Unless they have the time they will do the translator for the day.
Less explanation. Right? So we're going to demonstrate and then
Okay. Has everybody had an opportunity, or do you need a little more time?
a little more time. Yes.
Okay.
You, the patient, are moving to the appointment. It's the same one.
So now it's like when the patient.
Yeah. So
I need to ask questions.
can you show me?
Maybe ask me as well.
Can you show me what I'm supposed to be taking?
What the pills. And I will inform the doctor that I have to dismantle. What if they just copy that stuff? He understands.
It seems like at least a couple of these have started.
Okay. You know what, if we go ahead and share our experiences, if that's all right, and everything? Who would like to start first and everything? We gave you 6 different scenarios covering the different segments that we had today and everything like that. Who would like to share their either their role as a physician or role as a patient, and what was the interaction like and everything? So,
We can go.
Celine, yeah.
We had one that there was a Spanish-speaking patient who went in to see, obviously, the doctor. She was experiencing different symptoms, and there was obviously a language barrier, so that was one of the struggles that we faced. The strategies that we used was using a translator, and improvements that could be made for future or similar patients. We suggested, of course, taking your time, making sure you're speaking directly to the patient, trying to be clear, and also making sure that there's a translator present so there's no barrier with the family member.
You guys are ready. That's great. and everything. Did you want to say anything, Jamie, or are you good?
Yeah, we're good.
You're good? Okay. And I actually have a game to do right now. It's the first person that volunteered to give our example and everything like that. Got Girl Scout cookies, so I just wanted to say thank you so much. Hopefully you liked them and everything like that. They talked me into those flavors, so I don't know if they're good or not.
Those cookies are really expensive.
Yeah. We have bottles of water for second place, actually. So, believe it or not, we actually do. So, who wants to share their experience? Who also wants to share their experience? I know the second place prize isn't as amazing, but it's very parching.
But we're good.
Yeah. All right.
So we had a dementia patient. The scenario from the doctor's perspective was patient comes in, doesn't think that they need to be screened for dementia. Patient's husband does because he's seen kind of reminders around the house, things lying around, sticky notes, that sort of thing. And then the perspective from the patient was, me as a patient, I don't need it, and the provider's being condescending. So lessons learned here being, make sure the provider is involving family members in the discussions and providing the care, because in this particular situation, they probably have seen the examples of the patient's family. And then as the provider, making sure that they're not condescending, understand the problems, and kind of walk that fine line of empathetically understanding the reality of what's going on, but also the fears of the patient that doesn't want to admit that maybe they are at risk for dementia.
Yeah, that sounds great right there and everything. Does anybody else want to share anything like that? It's a $1 value right there. It's a $1 value. It still has value. Does anybody else want to share?
Can I add something about dementia?
Yes.
I think one of the hardest things when you deal with patients with dementia is we go to them all the time. Who's the president? What is the year? We ask them similar questions. So what you don't realize sometimes is you can actually find out how oriented people are without being that targeted. So you can go around. So for example, if the TV is on, I'll say, oh, wow, what do you think about what happened in France? And see what they relay back to you, because it will tell you how much they understand, what are they paying attention, those kind of things. So you can kind of do it in a non-condescending, sneaky way to see really how oriented they are without them really knowing it, and it's a little bit more respectful. So I found that to be much more helpful, because let me tell you, every nurse and doctor and physical therapist that walks in the room asks them who the president is.
Rather than giving them a citizenship test, ask them real questions, right?
So, it's fine, but that doesn't tell you. So it's really being able to maintain a conversation, asking them about, I saw that last time you were here, you told me that your son graduated from college. So I used to write down little notes to be able to, just for myself, to be able to go back and see how they remember those things.
Yes.
That's a non-threatening way to be able to. I'm sorry.
No, don't worry. That was perfect. That's perfect. We have an expert right here. So we've just read a couple chapters. All right. Well, it sounds like everybody has had a chance to kind of share their experience and everything like that. We want to know, do you have any questions? And also, if you have any questions, we put our email up there as well too, so that way you guys can email us for our presentation and everything like that as well, just in case. So, are there any questions?
That's all.
I have a question.
Oh, yes.
So have you yourself, because I know you talked a lot about like having these barriers, communication barriers.
Yes.
So like any of you, have you yourself either in a professional manner or as a patient experienced some kind of communication barrier?
From my mom.
Okay.
In my case, my mom had all three of them. And when she goes to the doctor, I had to go with her all the time because she would not understand what the doctor is saying, because she never really had any formal education. So that's one of the reasons why. So that was a big language barrier for my mom.
Actually, with my wife, she's a pediatrician, so she actually has a background in healthcare, but she's from Ecuador, so English is not her first language. And I saw it not too long ago when we went to the OB for a checkup and everything, and the nurse practitioner said slang and everything. And my wife's like, what was that? After she left and everything, I was like, oh, it means this and everything. So instances like that and everything where I've seen first language issues, especially with slang that we use commonly and everything like that. We think that other people know, but it's like a couple different ways to skin a cat, whereas they whip cats over in France and everything like that. So rather than using that slang, we need to use plain language and everything. So sorry about those examples and everything. I hope that helps.
And I also don't ask them, do you have any questions?
Yeah.
So you know.
Yeah.
Because some people feel stupid if they have questions. So I usually say, you know what, one of my goals that I pride myself is trying to be a good communicator. So can you tell me back what I told you? And I said, this is a test on myself because I have to make sure I'm doing a good job. And then it doesn't make them feel bad if they didn't understand, because people who don't understand, sometimes they won't ask you questions. But then I tell them it's a test on me, and then they're like, oh, okay. Because then it's not.
It encourages them to be able to, react
it
back
puts the
and be
pressure
able
on
to
me
interact.
versus
Absolutely.
them. So I do that a lot.
We want to be able to provide an opportunity for them to ask for support and everything. That's actually one of our points in our conclusion and everything.
Oh, sorry.
So no, that's perfect, because it means that you guys are getting it and everything like that. So this is great. And does anybody have any other questions or anything, or is that for right? Is that it for right now?
I
Yes.
have a question. So you're saying that if you come across a patient who cannot read to them, how do you identify the patient that can't read without offending them and making them feel embarrassed?
You don't mind? Oh, do you want to take this one? Or?
Good
So
question.
asking is always part of it. Of course, there's, people can be prideful.
Right.
People can get embarrassed. So I think the best way is probably a bit more covert way. There's always asking for support of family and friends. If they can't read, it's possible that their family friend may be there to answer that question for you aside.
Okay.
And then as well, just picking up on nonverbal cues of like, oh, here's this information sheet. Did they not even take a look at it? Did they give it some confused looks? Things of that nature when they...
And another tell is they'll say, oh, I'll take this home and read it right away and everything like that. Whereas that's another big issue is that they'll say, oh, yeah, don't worry. I'll fill out all that paperwork after I get home and everything like that. I'll bring it to you tomorrow. Because sometimes, like you said, they're prideful and everything like that. They're embarrassed because sometimes people fall through the cracks, unfortunately, and everything. So that's another tell is to be able to, if they're like, oh, I'll just take it home and everything. If they're at the doctor's office, they've got time to spare and everything like that, so they can fill out the paperwork and everything.
This is what I do. I know, I'm sorry. What I say is, listen, you've been given a lot of information, and I look at it ahead of time, and I'll look at section, say maybe on the third page where it says, where to fill your medicines. And I'll say, do you mind looking to this part where it tells you about the pharmacy? And seeing if they can flip through it.
If it's right.
Because I want to go over it with you. And then it's not me asking, can you read? Do you know where it is? It's asking them to find it. And I see if they have difficulty, then I can take it the next thing. Well, it's okay. Why don't we go over it together? Does that make sense?
Yeah.
That's what I do because it's not threatening.
Right.
Yeah.
And that's a great technique as well, too, and everything like that. Say, kind of like show them where the stuff is inside as well, too. So, is it, all right, I guess that's it for the questions right now. Is that right, everybody?
Great job.
Okay. And now,
In
Indira.
conclusion, healthcare professionals can achieve more effective outcomes for these 6 patient segments through adapting communication as well as creating a lasting impact by properly assessing the patient.
And we need to remember that there's several key points that we need to take home from this. There are varying levels of health literacy, and we need to know how to identify and interact. We also need to adapt our communication for the patient as well, too. We need to be able to show empathy and respect to the patient. And we also need to be willing to properly assess the patient and be able to give them a lasting educational impact as well, too. So I really hope that helps out as well, too, with taking these points home.
So as we wrap this up, we want to remind you of the 36%. We, as healthcare professionals, can either